Tell us about the initiative, about this launch of this ICTC or something.
Yeah, today is the official launching of the intensified IEC campaign on the occasion of International Day 2025. The main aim of this, the main objective actually of this campaign is to generate more awareness on HIV/AIDS to the general population, and for those who are actually HIV positive to seek treatment. Also, we have to talk about in this campaign. We also have to talk about sexually transmitted infections, the routes of transmission, and also to encourage people to come forward to do the HIV test.
Well, how do you see the HIV prevalence rate here in Meghalaya as compared to national level?
The prevalence is double. Our prevalence rate stands at 0.43%, while the national average is just 20. So Meghalaya is like double of the national average. So when we talk about the HIV prevalence, we stand at number 6 in the entire country, and when it comes to in the Northeast, we are at number 4.
So what are the reasons according to you, as far as Meghalaya is concerned?
Because according to our data, 80% of the people living with HIV are from the general population, meaning heterosexual sex, non-commercial partners, and there is of course from the other high-risk groups as well, like female sex workers and then injection drug users. But according to our latest data, it is 80% is from the general population, that is having multiple sexual partners, unprotected sex.
Well, is it true that the HIV nowadays is showing increasing trend among the children, and especially the children? They are reportedly going towards drugs by the age of 10 years. So the HIV prevalence is increasing amongst the children.
Among the children, the research was done, yes, of course, because it came out in NDTV, it came out in the news. And but I would like to state here, especially for children living with HIV, out of the 10,000, 400 plus are children living with HIV. But none of these children that have registered with us comes from the injecting drugs community. So for us, we have these targeted interventions that we have for high-risk groups, especially for injecting drug users, which also includes the female injecting drug users. So we have the harm reduction strategies, but yes, we are seeing an increased trend actually especially amongst injecting drug users also, because most of them actually share needles. So that is one of the reasons for the rise amongst the injecting drug users.
If you can a bit elaborate on the studies that was done by Meghalaya AIDS Control Society.
This study was done in collaboration with the Indian Institute of Public Health. So the study was it's not specifically the entire Meghalaya. We have specifically chosen a few districts where it shows where more injecting drug users are there. So from this study, that is the reason why they've shown as young as 10 years that kids are getting into this very sick disease of doing drugs and injecting drugs. So our main motive is actually to encourage them to not do drugs anymore, to lead a healthy life, and actually to know that HIV is true.
Your name, please. Name and
what you are doing right now after this study is being done? How you are? What action are you taking?
As part of the intensified IC campaign, we are not just going to be talking about the route of transmission, but we'll also be talking about because one of the major route of transmission is through infected needles and syringes. So one of our main agendas actually, when we go to areas where we know there are the population of injection drug users are quite large, we'll be stressing more on the drug use and how to prevent.
your name and designation, please.
My name is Ajoy Amlanong, Deputy Director Mainstreaming, Meghalaya AIDS Control Society.